What's up, Doc Mike? Public Health on Call. By Johns Hopkins Bloomberg School of Public Health. Today's topic for April 4, 2021. Virtual showtime at the Apollo Theater. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, I speak with Fatima Jones, the Senior Director of Marketing and Communications for the historic Apollo Theater in Harlem, New York. Our topic is how the theater has adapted and expanded its activities while staying true to its mission during the COVID-19 pandemic. Let's listen. Fatima Jones, thank you so much for joining me to talk about the COVID-19 pandemic and the Apollo Theater in New York. Could we start by just telling me about what happened when the pandemic struck?
Well, first of all, I just want to say thank you for having me. It's such a pleasure to be here. Well, the first thing that happened when the pandemic struck was that we thought about our staff and protecting our staff and just making sure that they were okay, as well as some of the artists that were scheduled to be at the Apollo and our audiences. So we followed the state guidelines and we put things on pause thinking that it would just be temporary. Actually, we had a play called Blue that was supposed to go to Broadway, but we ended up striking a deal to have it at the Apollo for, I think at the time it was supposed to be 8 weeks, which is not typical for our theater. And we kept pushing it, thinking, okay, in a couple of weeks, we'll just schedule another date. And then we pushed it again and then realized that this was going to be where we were going to be. And we quickly shifted to digital. And so since March, actually, we've had more than 50 virtual programs on what we call our Apollo digital stage.
That's a big transition for an organization your size to make so quickly.
Yes. It was a huge transition and we're still reeling from it. Frankly, it's been a year, but it really took a different way of thinking, a different way of structuring the way that we produce a program, less silos, more collaboration between different departments. And luckily, we had a number of people on our staff who had some experience in the virtual world, and the rest of us just got the Cliff Notes and jumped on board.
Tell me about some of your favorite programs from the year.
Oh, man. One of my favorite programs was our June benefit, where we had a few people. We had a few folks from different groups who did a version of Papa Was a Rolling Stone, Michael McDonald, and a few other people. And it was really a lot of fun. And we also had some dance. What's great about virtual is that we were able to tap some artists maybe that would have been harder to reach. Now they were either A, available, or B, because of not having to travel and things like that, we were able to secure them. So that was one. The other one was a great conversation with John Legend, who talked about the role of an artist in times of trouble. And I think just hearing from other artists talking about what they're doing right now is really important for people to hear. I always love a good DJ set. So anytime we have a good DJ that plays and you can just log on and do your work while you're listening is always fun. And then we've had a number of other programs. I'm trying to think. The last one we had was a huge festival called the Women of the World Festival that had over 80 artists, thinkers, and activists from around the world. 90% of them were women, talking about issues of the day. And that was a huge undertaking and well received by the public.
How have the audiences been?
The audiences have been good. It's a little bit up and down sometimes. I mean, what we found is as we got into the year, the virtual space was very crowded with other events. So we really started to hone in on who actually is this for and just marketing towards those folks because there's so much that you can do virtually now and everyone's doing it. So it definitely got a little harder to kind of fine tune who the audience was, but I think we're in a good place. So far, so good.
That's good. And all of our podcast listeners can tune in.
That's right. All of your podcast listeners can hit our website and check out the digital stage. That's one of the beauties of the virtual spaces that our followers in Japan or Brazil or wherever, they can log on and see shows that maybe they wouldn't have been able to see if we were in the real world and in the real world on the stage.
So you mentioned the discussion with John Legend about the role of artists in times of trouble. What's the role of a historic arts venue like the Apollo Theater in times of trouble? What other kinds of work have you been doing?
Yeah, thank you for asking that. I mean, I think the Apollo is such a unique organization, right? We're in what is probably known as one of the Black meccas of the country, which is Harlem, New York. It's still, although it is gentrifying, there is still a strong population of folks from the African diaspora, both African Americans, folks from the continent. And one of the first things we did was to collaborate with the artist Carrie Mae Weems. And she has like a public health art project that we jumped on board to do, putting out messages of hope, messages around being safe around during the COVID, when the COVID pandemic was at its highest. The other thing is that we just feel like we are a beacon to folks in not just Harlem, but in New York. And so one of the fun things that I am in charge of, that I'm very proud of, is that we get to put things onto the marquee that you can see from, avenues away. And, as soon as the pandemic started, we just put up messages of hope and things like be well. During the election, we just talked about how only love can conquer hate, just things to kind of keep people uplifted. The other thing we did was we started an initiative called Apollo Cares. And there we kind of just have references and information for folks who live in the neighborhood and also anyone who can access our website, resources on how to get more information about the COVID vaccine, public health messaging, financial resources, things like that. So definitely our role is always, we can't be here unless our community is here. So we need to make sure that they're safe and that they're okay. The other thing too we did was we started a micro grant initiative where we worked with two other organizations and gave out $21,000 micro grants to our businesses that were hyper local to us. So like they had to be in our radius. And
could you give a couple examples of those grants?
Yeah. So one was like a health fitness studio that could not function at the time. Another one was a local vendor. If you've come to Harlem and you've come to the Apollo, you'll sometimes see the vendors out on the street selling T-shirts and hats and things like that. Well, they can't run their business if there's no foot traffic. So we gave money to them. There was also an interior, a Black-owned, female-owned interior design company. So there were 20 different companies. And what we know is that the health of our community is our health. Right. And our health is their health and from a financial standpoint. So we're looking to do that again this year.
That's great. And it brings you closer to your community in a way that you were
That's
close,
right.
But now it's more intentional.
Mm-hmm. Yeah. And they know that we're connected, right? We're all connected. And that's the one thing that we've learned from this pandemic, right, is that we are all connected. We keep getting that message over and over and over again. Some of us are not getting it, but some of us do. And, I think we all have a role to play.
As the focus of the pandemic response has shifted to the vaccine, has the Apollo Theater been involved in that work?
We're just starting to get involved, honestly. We just had a couple of, for our internal team, we had 3 doctors come and speak with us about kind of the truths and the background around the vaccines, giving us all a little bit of information about the questions you need to ask and the steps you need to go through to consider getting the vaccine. As you probably know, that in some African American communities, African diaspora communities, the conversation around the vaccine can be a little tricky because of historical inequities. And we understand that that is a real thing, and you can't be brushed over it. There sometimes needs to be a little bit more conversation around it in some communities. So we're first starting with our internal staff. And then what we're hoping to do is actually to share that the doctors approved to share that webinar that they did with us on our website so that people can access it as well. So we're starting to see what we can do there.
That's great. And tell me a little bit more about how this year has gone for the internal staff. I know we were talking a little bit before about the pride people feel in working for the Apollo Theater, which is just such a remarkable history. How has this work during the pandemic shaped people's sense of what they do for the theater and the community?
Yeah, that's a good question. There's nothing that can replace the theater inside of it. Like there's just nothing, right? The theater is just it's a space where so many legends have walked through, and also not just the legends, but just all of the great energy that that tourists when they come bring, folks from the community when they come through. So there's just if you believe in that kind of thing, there's just a lot of energy in that space. So when you're in it, you feel almost like in a warm hug. So when you're in the virtual space, it's really cool. Like you get to see different things, but it doesn't take the place of being inside the theater. So I think a lot of us miss the space for sure. I was actually there a couple of weeks ago. We did a partnership with this group called Versus, and the artist D'Angelo did a live stream concert from the theater without an audience. And just to be 6 feet away from him, like singing, it was just like I almost cried, because it was I just missed having live music in front of me, And so I think a lot of us are missing that. But, I think we're all understand the mission of the theater, which is to serve the pleasure of audiences that love Black culture and to support Black artists specifically. And so that mission has not changed. And so now we're just trying to make it work in the virtual space until we can be back in the theater. And we've had actually a couple of no audience performances. The artist Wyclef Jean from the Fugees did our first concert without an audience. And that was pretty cool because he ended up coming out under the marquee and played a little bit outside. So we're right now just trying to figure out how we can safely get back in the space, but also, I think that there's a lot to learn from this time. And so we're just, trying to make it work for right now. And people are just really pulling together and working really hard, to be honest with you.
Yeah, it's pretty amazing when you're not in the office how hard you can wind up working.
Yeah, definitely.
So as you look forward, do you think that the theater will aim to just go back to the kinds of programs that it had before the pandemic, or do you think the pandemic will have a lasting impact on the work that the theater does?
Yeah, I mean, the Apollo is, like I said, mission-based. So the mission is the same. So we will probably be doing more of what we were doing, plus the virtual space, because we can't abandon the followers and the folks that have been watching from all around the world. So I think there will need to be almost a doubling of effort on some of the programs to see how we can continue in the virtual space. Actually, this year, because of the pandemic, was the first year that we did amateur night auditions virtually. And that was pretty cool. So one of the things I'm really looking forward to is when can we bring amateur night back? Because it's super fun.
I was just reading some of the people who got their careers started at amateur night.
Yes, that's right.
You want to tell our
That's
listeners
right.
who those people are?
Yeah, there are a number of folks who started. So James Brown was one, the Jackson 5, Jamie Foxx, Chris Rock, Luther Vandross, D'Angelo, Lauryn Hill. A few of those folks got booed off. Actually, Tracy Morgan recently did something for the NAACP Awards and mentioned how he got booed off so bad that his parents tried to act like they didn't know him after the show.
Well, it's important to get the amateur night going again.
Oh my gosh, it's so important. And it's the nucleus of who we are, which is to have that call and response of audience to artists, and not in a mean way. Because one of the things that I always have to remind people with amateur night is that it's not that you don't have talent. It's just that today wasn't your day. As my husband calls it, you had a bad day. You just had a bad day that day. So, but just to see just to have joy. There's so much joy in that program. And the beautiful thing about the Apollo is that although we kind of, we service and we're at the mission of servicing Black artists and creativity, this is something that anyone can enjoy. And so we're used to having tourists from all over the world be a part of what we do. And we miss that.
Well, you'll be able to have live performances in the future with an
Yes.
audience and a virtual audience, perhaps.
Yes. God willing. I can't wait. I really can't wait. We're all ready.
Well, so are we. Fatima Jones, thank you so much for joining me.
Thank you. This is great.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for